You're listening to IHC's Podcast. Welcome to the IHC Podcast, where culture meets community. My name is Marissa Hemstree, and I'm from the Canyoncito Band of Navajos. I'm also the communications coordinator for the Indian Health Center of Santa Clara Valley, where we provide medical, dental, WIC, and prevention services to over 23,000 members. And we specialize in the unique healthcare needs of American Indians and Alaskan Natives. Today, we're here speaking with Dr. Fitzpatrick.
Hi. Hi, everybody. I'm Judy Fitzpatrick. I am a family doctor and a third-year resident, about to graduate Stanford-O'Connor family medicine program, where I work as a primary care doctor at the Indian Health Center and also in the hospital, delivering babies, taking care of newborns, taking care of adults in the hospital, a little bit of everything we like to do in family medicine. My pronouns are she, her, hers. And a little bit about me. I'm from New Jersey originally, a big, tight-knit family in New Jersey. But I've been in the Bay Area for about 11 years now. Went to med school in San Francisco. And I'm a new mom. I had a baby 3 months ago.
Ooh, congratulations.
Thank you.
You can't tell at all. That's awesome. What got you interested in becoming a physician?
Yeah, so I grew up in a tight-knit family in New Jersey. My oldest brother, Dennis, who's 4 years older than me, has cerebral palsy. So shortly after birth, had complications with getting enough oxygen to his brain. So he is permanently disabled from that, uses a power wheelchair to get around, has speech difficulties because of that, but those who know him well can understand him well. So growing up alongside somebody who has a lot of disability, it was very clear to me that we need a really robust safety social net for our community members who are the most vulnerable. I think we were very lucky growing up in a relatively comfortable middle-class environment in New Jersey, but I would always think, even as a kid, I remember being like, well, what if my brother was born into a different family? You know, it's hard. It was hard even for us, having, anybody with a disability in your life is very, very expensive. But luckily his basic needs were always met. And I just would think like, what would happen to my brother if that wasn't the case? And just that we need really robust services, medical services, educational services, therapy services, employment services for folks with disabilities. And so I really wanted to be a part of providing that care for people. And so that's why I decided I wanted to be a doctor.
I like that. It's like your purpose of statement for grad school.
I think I actually wrote about it in my med school application essay. I think that was the gist.
Yeah, that's a really strong why. That's beautiful. Thank you for sharing that.
Thank you.
And that kind of leads us into our why we're here today, because July is Disability Awareness Month, and so that's why we wanted to bring you in and talk to you a little bit about disability awareness, and then if you're able to share some of your experiences as a family member of a person who is disabled, and what that journey's been like for you all.
Absolutely. Yeah, it's just, it's so part of my lived experience. I can't even not think about it. When I go into spaces, even now living across the country from my brother, we talk all the time, but living far away from him, whenever I walk into a place, I'm like, is this accessible? We never took for granted growing up that we could just walk into any space and that my brother could go, very frequently, even if there's just a few steps. And, sometimes folks, don't have the disabilities my brother has, where it's just so visible what his limitations are. But just thinking about the ways that people navigate this world and how our world is not built for folks who are differently abled, and that's a really big challenge, is something that I just grew up knowing in my bones. And so I think it's something that we can really challenge ourselves to design our world better. We were lucky enough to go when we were little once to Disney World, and I just remember being so shocked how accessible Disney World is. And my brother could just go everywhere, and he had such freedom. And obviously there's billions of dollars behind that. And it's just, but I think we could take a chapter from the Disney World book in terms of designing all of our spaces with that in mind, whether that's, private spaces, public spaces, just making sure that these folks can get where they want to go and lead full lives.
Yeah. And do you think that, growing up the way that you did and, just for you, it's kind of like, it's not something that you have to think about all the time. It's just the reality of the perception that when you walk into a space that you're saying that you just kind of look around like, are there ramps? So,
Totally.
Are there only stairs? Is there elevator working? And what are some ways that you think folks can improve their spaces or make it more accessible?
Yeah. I think just, in whatever position of power you hold, whether you're a teacher, a restaurant owner, a person who's just running into somebody, out in the world, just ways that you can use your power to make our communities more available for people. I think if you're opening up a new space, if you're working in a clinic, if you're working in a classroom, thinking creatively on how to engage folks. And I think one thing that's really shaped my experience is through my brother. He's so smart, he's so funny, he's such a full person. So I've never questioned that. I've because of him, I've always been able to see past if someone might look differently or, have something that might jump out as somebody as scary or something that they don't understand. And that's been a real gift he's given to me. So I encourage folks to engage with people with disabilities. If you don't have a family member, if you don't have a friend, go out and try and make a friend. Look into organizations in your community that work with folks who are differently abled, because I think that they're the best people to ask on how to design our world better. So in whatever position of power you hold, try and talk to somebody who has had a different experience on how to make that space more accessible to them.
Yeah. In my previous capacity as a fitness coordinator here at the Indian Health Center, that was one of the things I had to learn to navigate, was working with folks who are wheelchair bound, working with folks who have multiple sclerosis or cerebral palsy, and other, physiological or neurological issues that might impact their ability to stand. Maybe they can stand, but not for too long, or they're in increased fall risk because of XYZ. And so really learning to navigate those challenges, especially in a fitness center type of space, was challenging at first, but I felt like it was a challenge that we could definitely meet, and we did, because we were able to work with those folks. But I know from firsthand experience, when you're just jumping into it as someone who hasn't been exposed to folks with physical disabilities, it's a little bit different. And I just remember feeling overwhelmed.
Yeah.
I was like, oh no, how do I make sure this person's safe? That was my immediate thought, was making sure that they're safe. And then the other one is that they felt included in whichever activities that we're going to do. So working with those folks has definitely, broadened my experience. And now I don't feel afraid when I see folks in a wheelchair in a wellness center setting. And I'm like, cool, there's things that you can do. We just got to modify.
Yeah,
and so
that's such a great example. I think in a fitness center, folks who are differently able need exercise. We all do. Mm-hmm. And so looking past that first, oh, I'm scared, I don't want to hurt this person, and then going one step further and saying, how can we get you to move, I think is so, so important. My brother, some of the most impactful people in his life have been physical therapists who just get really excited about how can we work with you to exercise today? So I think that's such an awesome example. And thank you for your work.
Yeah, and it's less of, oh, we can't do this, and more of, ooh, we get to do these things.
Yeah,
and
it's
I
cool.
get to pull out the resistance
It's
bands.
creativity in your work, and that's your expertise that you have in physical activity, and we can all kind of harness that creativity, and it makes things more fun and welcoming and open. And I think that's such a good example of applying that challenge to each of our roles.
Yeah, and there's always ways for you to be inclusive in your space, whether it's physical or neurological issues that folks are dealing with. For example, in the wellness center, we started using the assisted hand grips for folks who can't really fully close their hands.
Yeah.
For folks who can't do that and they want to do strength training, we learned how to use the ankle straps that go onto cable machines and put them on the wrists. We got multiple for them to be able to use those machines, and just changing the way that we thought about exercise traditionally. And even I don't know if they still have, but we had a chair exercise class. And in that class, we gave folks options, seated or standing movements with or without bending over or sitting up, just in case folks had vertigo.
Sure. Yeah. That's great. Yeah. That's such a powerful example in action. I love it.
Yeah, so that was a fun and, like you were saying, like really creative time in the Wellness Center. And then I'm happy to hear that the new fitness coordinator, Danny, he's working with folks of all abilities and all level.
Love it. That's amazing.
Yeah. What are some of the biggest challenges that you faced in supporting your brother and accessibility in certain areas, and how did you overcome those things?
Good question. I think one of the biggest challenges for my brother and our family has been kind of the transition into adulthood for people with disabilities. Again, my brother grew up, we had a really good public school system. He loved school, got picked up at a bus every day in his wheelchair, and really thrived in school, super smart. But that transition into adulthood was really hard. And I think we don't do a great job as a society of thinking creatively on how to transition these folks into, additional education, meaningful employment. Again, I think so many of those opportunities could come out of just folks thinking creatively, thinking like, hey, there's so many of these people, they have different needs, but look at what they could offer. And I think it's a real untapped resource that was challenging for my brother as he made that same transition. I think mental health struggles for folks who are differently abled. Thinking about my brother who has a very physical disability. Always questioning kind of the mental health of those folks is important, because I think it's really challenging to navigate a world, again, that's not necessarily built for you, and there can be a lot of anxiety and depression that people experience because of that. That's very, very real. And so that's something that's important to me in my job as a doctor for my patients who have disabilities, whatever it is, just always making sure I'm checking in with how they're doing mentally and how they're coping with the real challenges of their day-to-day. And how we can capitalize on this resilience that is so innate to this community because they've had to overcome so much already, I think is really important. I'll highlight a community resource that I think is a powerful one in helping all of these issues that I'm discussing. Hope Services, which works with children and adults, providing day programming, providing really powerfully training and employment opportunities. I wish I could see much more of that in this area and all over the country, because again, I think our community members with disabilities are such an untapped resource. I think they have so much to offer and could just be brought into the public space so much more. I think there's a lot of unnecessary kind of hiding of these community members because we just don't have the infrastructure in both kind of our public-private employment settings to bring them in, and I think that could change, and we would have a lot more visibility of folks with disabilities, which I think is very important, because as we're saying, once you work with someone, like, you have just such a different experience, and so I think bringing them into our communities and in all of our spaces is really powerful.
Yeah, and I like the way that you're sharing that. Some of the ways that you guys have, your family and yourself have overcome this is, seeking, like you were saying, like possibly training or looking for these services that are there to help folks who are differently abled. And like you were also saying, too, checking in on the mental health of these folks, too. As a trainer working with a person who had multiple sclerosis, that was one of the things that I dealt with, because people with MS, they may have been more able-bodied before, but as the MS progresses, they lose that some of that ability, or if not all.
Yeah.
And so the person I was working with was like, I used to be able to do this, and they would be so depressed because of not being able to do X, Y, or Z, and that was one of the things that I learned to work with them about, and just realizing, yes, we could have done this in the past, but let's look at what we can do right now.
Yeah.
How can you achieve the end result that you want without shaming yourself for feeling like, oh, I should be better than this? You appreciating who you are now and what ability do you have now? And if you don't have the ability, how can we work around that to ensure that you are able to, grab a cup or something, or grab the remote, or, stand up for a moment, things like that.
Yeah, that's so important. And I think, as you say, there's a whole host of challenges that are specific to folks who can have possible degenerative conditions, or when they are, losing capacity, that can come with a whole host of other concerns, including just the mental health impact of being once able to do something and losing that ability, and trying to figure out ways where we can engage and encourage in those moments, I think is really important.
Yeah, so the disability array is a really big spectrum. It's
Absolutely.
for folks who grew up this way, or folks who, like you were saying, might have a degenerative issue that might potentially get worse. But,
Absolutely.
Making sure that our mental health at each stage of whichever path you're on is, where it should be.
Absolutely.
Yeah, and I'm appreciative to hear that there are physicians like you who are checking in on these folks, making sure that they feel valued, they feel seen, and that their overall well-being, not as just physically, but mentally, is taken care of too.
Yeah.
So often with like physicians, it's like, oh yeah, okay, you're good here, okay, good. But not so often do I hear that folks, go to their physician and they're like, oh, they're referred to go see a counselor, therapist, social worker, just based on a certain conversation they may or may not have had. So
yeah.
Thank you for taking care of not just their body, but their mind.
Thank you very much. Yeah, it's a privilege to be in the role of the doctor. And I think having the experience with my brother, I've tried to be the doctor that I want for him. And I think sometimes it's hard to understand what those needs are if you're not up close and personal. So I think it's important to share these stories and push us all in whatever roles that we have to kind of see these folks for who they are, and work to provide them better care in whatever way we can.
Yeah. So one of the things that you had said was Hope Services is a really good resource. Are there any other ways that you feel like society or just organizations as a whole can support and accommodate individuals with disabilities and their families? Like, what does accommodation and accessibility look like?
Yeah. Yeah, I think, for anyone listening who may have a disability or a family member of somebody with a disability, you're so used to that, layer of thinking for everything of like, am I going to be able to do this? Or how can I do this? How can I piece this together? And so I just really encourage that type of thinking in everyone, and bringing that thought process to your professional life, in whatever it is that you do, in your personal life. Just how we design everything, I think, could be really informed by just that extra layer of thought of, will someone with a wheelchair be able to use this? Will someone who, can't use their hands very well? Will somebody who, has a severe mental health condition, how would they be experiencing that? And I think, if you've never lived up close to that, up close and personal, it can be hard to have that layer of thinking built in, but it's contagious. And once you kind of get exposed to thinking that way, you can see all the things that can be improved. So I wanted to highlight another piece. One of the IHC doctors, Dr. Watson, actually helps lead a camp called Camp for the Stars in San Jose at Valley Christian. Actually, they involve like NFL players who teach a camp for kids with Down syndrome, and it's such an awesome organization. And we have football camps, and so kids of all different abilities should be able to engage with that. So just those things of kind of saying, well, this one kid is going to football camp. Like, could either my patient or my child or my family member or my friend, go to that same camp, or should we design a whole special camp for kids with Down syndrome, whatever it might be? Mm-hmm. I think just having that extra layer of thought is really, really powerful. And, everything that exists in our world, should be, able to be accessed. And so everything that one person may like to do, just having the thought of, well, if I like to do it, probably this other person might like it too. So let's at least make it available to them. And I think that's where I come back to really connecting with these folks, because once you have someone in your life who might be differently abled, it's very easy for you to understand that the richness and fullness of that person, and then trying to modify things to help bring them into these spaces.
Yeah, and that's a common train of thought with folks, because I'm actively involved with like the deaf community here in San Jose, and we have events called Deaf Night Outs, DNOs for the folks, and at those events, because we were looking for venues, they host one in San Francisco, one in San Jose, and they're like, oh, do you guys have any ideas for San Jose locations? And everybody in the chat is like, okay, well, first we need to make sure lighting's good. We need to make sure there's ramps. If it's 2-story building, we need to make sure that there's an elevator. Does the elevator work? When was the elevator last checked?
That's awesome.
All of those thoughts. And I just think it's beautiful that, not only the folks who are actively experiencing these physical challenges are the ones chiming in and saying, it's folks who are running the groups. They're mindful of everybody who attends, because they want to make sure that they all have a place and they feel valued. And I mean, being deaf is one thing as well, but then they might also have other issues going on with them that they want to be mindful of in a certain space. And I just like that level of visibility of folks, especially in the deaf community. And so it's nice to hear that, that there's ways to continue this and to think about it, especially as like Indian Health Center. One of the things that we have to do and be mindful of, because of like county coding, is making sure that, any of our places that we have our locations at and have patients coming in and out, that all of those areas are accessible. But it's hard for other businesses who maybe don't have to meet those certain standards. And that's where that like disconnect is.
Yeah, I'll share. That makes me think of another experience that we have as a family. Growing up, instead of going to traditional summer camp, we actually went as a family to family camp for families of children who used communication devices to interact with people. So like computers that, kids with disabilities could use to speak if they had, speech difficulties related to their disability. So that was summer camp for us growing up. And it was awesome. It was a place for my brother to interact with other kids who used communication devices who had disabilities. It was a place for siblings to meet other siblings and kind of connect about shared experiences there. And it was such a wonderful illustration of ways that, differently abled folks can do the traditional summer camp activities, swimming, trying to figure out ways to do archery, different like capture the flag. Even there was a rock wall, and like managed to find a way to get, lots of kids with cerebral palsy and other, movement limitations up this rock wall. And I then went on to become a camp counselor there. So I think it's just, all these ways that we can, engage with these communities. I think that's so awesome, your work with the deaf community here. And yeah, just having a night out as, other folks would do, and having that added support, knowing that they're, going with a group who is calling ahead and making sure that picking a spot that is going to be accessible to them, I think is so great. And that further emphasizes the point of just like getting out in the community and having our communities see each other for who they are, and not just kind of being around, similarly abled folks and thinking that, these other communities don't exist because they might not be necessarily as easily welcomed in those spaces, I think is really important.
Yeah, and DNOs are awesome.
Yeah,
it's
that sounds great.
Bunch of deafies taking over,
how cool.
like bowling alley or an eatery, and then it's funny to see like a lot of the hearing people's faces when they just see people throwing hands, signing.
So cool.
Yeah, and they do warn the staff like, hey, a bunch of deaf folks and hard of hearing and other folks are coming in, and so just they might use their phone a little bit more to communicate with you. I mean, if you know sign, cool, but if not, don't worry, it's all right.
Very cool.
And I see all like the people taking the orders and they're reading the text on the phone. It's just a wonderful amalgamash of all these different communities coming together and trying to communicate and doing it well, even though like they probably weren't 100% prepared for that.
Very cool.
Yeah. So what role do you think family members play in promoting disability awareness and inclusivity in their communities? You've kind of touched a little bit on that with, making sure like you just already kind of walk into spaces because you've been through that for so long, and that's just been your reality of making sure that these spaces are accessible. Was there a time that you ever had to advocate and, or had to ask like, oh, is this available?
Yeah, I definitely think, from a very, very early age, so countless times, every time probably, we go out as a family, we're all just, it's second nature for us to be doing that, advocating or facilitating, getting my brother around. And I think, just for family members and loved ones, just to be vocal about your experiences, share about your loved one with everybody that you talk to. Think about it in your own positions of power. I think that's very natural for folks to do when they're very close to someone with a disability. So I'd even say, the folks who are immediately around folks with disabilities, there's a lot of caregiver burnout. There's a lot of, so thinking, if you're one step removed from these people, more those folks questioning, how can I bring this experience closer to me? How can I challenge myself to take a look at who I surround myself with, and is there anybody who's differently abled there? Because I think loved ones are already doing so much work, and just naturally kind of speak about their experiences wherever they go. Because once you see it, you can't really unsee it in everything you do. So really, I think the next step is a challenge too. If you have no one in your life, whether that's personal or professional, who's differently abled, kind of questioning that and figuring out small ways that you could start to build on that and diversify your experience so that you can ideally diversify how you, engage with the world and how you can make it a more welcoming place.
Yeah. And I know like folks, they commonly think this way for like elders, for people who like, maybe they can't stand for very long. And so like you give your seat to the pregnant woman or you give it to an elder, also be mindful of other issues that folks might be facing, and just making space for those folks, because I think that's what's important.
Absolutely. I completely agree.
Yeah. Have you seen people's attitudes evolve towards disabilities or being differently abled in general and like the community at large, and then even within your family, if maybe you had a family member who wasn't as exposed to your relative with that is just differently abled?
Yeah, I think, I've always been able to see the way in which people's attitudes morph immediately when they know my brother. Even if it's somebody who we're at a restaurant and it's our waiter or waitress and then we end up making jokes, like I can watch people see my brother more as a full person just with a simple interaction. And he's had such a positive impact on people's lives, I think, because he demonstrates that. It's very easy to get to know him and understand that he's awesome and so complex, just as you or me. And I think that is really transformative for anybody who gets to know him. And we have a big, huge family with lots of cousins and aunts and uncles, and they have all been transformed by having him as a family member. He has 1 million friends. My parents have 1 million friends, and everybody is better because of knowing my brother. And just, I think that's changed their attitudes towards people with disabilities. So that's why I always encourage you to seek out, differently abled folks in your life, because I think it's so beneficial for you. And I think we're getting better as a society. I think, in media, we're working to start to portray these experiences of differently abled folks. I think we have a long way to go. But the more and more visibility that these folks get, I think just the attitudes naturally change and accessibility then improves everything because people get used to this line of thinking. And so that's why I just encourage these connections to be made.
Yeah, I like that too, and I like how passionate you are about your brother. I mean, of course, everybody's sibling's just amazing. But like, I feel like a whole other level with you, and that's beautiful. I hope he listens to this episode and he's just like, I don't think
I'll share with him. He's my older brother, so he can't know that I was speaking this positively about him.
You're like, there's too much love. I'll hold off. I love that. Can you think of any like specific story that you had, like where somebody might have like approached you and your brother with like a negative attitude at first, or just like a uneasy attitude? Because I understand the feeling of like, oh no, I'm scared, but then also like, get over your fear. Like this is their life. This is just how it is.
Yeah.
And just because you're not used to it, that's not their problem.
Totally. Yeah, I think by and large, people are very open and very accepting, and in that way, it's been a great privilege to navigate the world alongside my brother and see how wonderful humans are, But even growing up, being on the playground with my brother, having other kids come up to me and ask, what's wrong with your brother, all these things. And that's a very natural kind of child curiosity thing. And so I think for me, just growing into the fact that that's a normal question and not being hurt or upset or defensive about it, although all those feelings are understandable, I've just then, able to then see the next step, which is that child, going to introduce themselves to my brother. I'm sure that's happened millions of times. So seeing, understanding that people's fear and questioning might come out strangely at first. And I think we should all work to, speak to each other in a warm, open, accepting way, but knowing that that's natural and that doesn't prohibit the next step, which is coming together and learning more and getting that exposure, which I think, is really, really important.
Yeah, and I appreciate you sharing that. Some of the questions that might seem uneasy, like as an adult, like you're like, oh, that's kind of rude. But then, like, children also have no prefrontal cortex going on.
Totally.
Like, nothing to tell them this is good or this is bad. It's just like unfiltered.
And this is probably, the first, this could be the first person that they're seeing who looks like my brother. And so that's a great lesson there. And then we can build upon that. So I think I learned how to do that as a child. And that's kind of stayed with me of like, building upon that questioning to the next step, which is like, oh, hey, get to know my brother. He's awesome. He loves baseball. You love baseball too. Just finding the commonality there.
Yeah, we're all human and we have similar interests.
Yeah.
Go talk to him. Don't talk to me. Yeah, I appreciate that like train of thought. And then for folks who maybe they didn't grow up this way, maybe like there was an incident that happened and now they find themselves like wheelchair bound or without a certain limb, different things like that. What's some advice that you would give to a family who this is a new experience for them?
Yeah, no, it's so challenging. And I think just really, sitting with them if this is a new experience and kind of, I think there's a lot of grief that can come as we were talking a little bit about working with folks who might have a more degenerative condition or losing ability. Just really validating that, I think, before moving to necessarily next steps is what I try to do, and in being empathetic if I'm with this person in a clinic setting, say. But then I think connection is often the next step, and it's been very, very beneficial for my family growing up to know other families with children with disabilities, and then they've grown up to be adults with disabilities. So working to connect with other folks who might be going through something similar, I think is a really powerful step in helping folks to process maybe these newer events that are leading to them having these experiences for the first time, and kind of validating that it's really hard. I don't think we can sugarcoat that being, a disabled person in this society is a hard thing. But again, I think going through these experiences, these folks are so resilient when they're moving through these tremendous challenges. So really validating that and building upon that. And I think ultimately connection with each other is what can help get folks through.
Yeah, seek out your community, whichever that may be now in this current moment for folks. And that's something that I see again in like the deaf community. Like as soon as I see somebody with, a cochlear implant or hearing aids or just signing, I'm like, oh, I'm all excited. I'm a weirdo. I'll go say hi.
That's awesome. Yeah.
And now it's to the point like my boyfriend will spot somebody with a hearing and he's like, hey, he might be, you don't know. And I'm like, ah.
But that way, if you go say hi, then you can invite that, you have such a tremendous resource to offer them if they're not already. I think the deaf community can teach us so much about community, because I think in general, there's just so many organizations and communities that come together so well. But you have this experience where you can bring them into your community effort. And I think that is so great, because it just is such a game changer.
Yeah. And it just gives you the sense of feeling like you're not alone, because you're not. The world's too big for that. So for me, I have auditory processing disorder. So I hear words, but I'll mix them up. So sometimes if I take a second to respond, it's because I'm formulating what you just said.
And look at you being a podcaster. That's not just an example of a tremendous resilience. I don't know what is.
That's like it helps to like look at somebody's full face.
Sure.
And during the time of COVID with face masks, I was at a lot. I felt like I could not comprehend anyone, and that got me to get a hearing test and everything and all that fun stuff. And they're like, it's just your brain.
Interesting.
But it's been instead of not being in denial about what I have, I fully embraced it, and I found community and other folks who have auditory processing disorder, and I think it's just a beautiful thing to have. If anything, it makes life fun because sometimes we'll hear crazy things, and those are not the right things that the person's actually saying. So I'm like, who knows? You might have said this or that.
That's awesome. That's super, super cool how you've, built that into your own experience and are now helping other people. I just think that is incredibly cool, and the world is lucky to have you.
Oh, thank you. I appreciate it. Do you have any other additional resources for folks? So some things I think you said are Hope Services, and then you were talking about like an initiative that Valley Christian School has for children with disabilities, like that summer camp. Are there any other programs nearby or even in New Jersey?
Yeah, I mean, there's so many resources for folks with disabilities. I think I really encourage folks to look within their own community and see what their community is doing and kind of which areas interest them most and get involved because there's so many efforts that I think, the coolest things that I see are like on a super local level. Obviously, there's so much that we need to get done on a federal level, a state level, but I think really exciting stuff in terms of getting to know folks who are differently abled are at the community level. So I really encourage folks to kind of look in their own backyard and take a poke around and see what's happening and kind of getting involved because I think that's what can foster some of these, person-to-person connections that are so transformative.
Okay, nice. I like it. So search some community resources in your area, wherever that may be, whether it's here in San Jose or in New Jersey. So thank you, folks, for listening. Some upcoming events at the Indian Health Center Santa Clara are on our website, so you can go ahead and check the link above. It is indianhealthcenter.org/events to stay up to date. So thank you so much for listening. Don't forget to rate, review, and subscribe. If you like our content, check out our social media. Our handle is @IHC San Jose. Thank you.